Good morning, and to our remote attenders, good morning, or good afternoon, or good evening, as the case may be. Thank you all for coming out today. The topic for our presentation is Accelerating Cervical Cancer Elimination in Low and Middle Income Countries through Development of a Costing Tool for Planning for Scaling Up. I'm Win Morgan, the primary developer of the costing tool in this presentation. I'm the principal at Levin & Morgan Global Help Consultants. This is our project team and my co-authors. Lisa Huang is the project director for success. Ann Levin is our lead health economics advisor. She is president of Levin & Morgan Global Health Consultants. Cindy Gauvreau is our technical advisor, and Nemdia Dassani is our research advisor. We have no conflicts of interest to disclose. So, planning and costing cervical cancer elimination is not an easy task. There's an especially great need in LMICs for guidance and assistance with completing costed scale-up plans to respond to the WHO challenge of eliminating cervical cancer by 2030. And over the past decade, one of the missions of Levin & Morgan has been to create tools and processes that allow governments in low and middle income countries to take ownership of their planning and costing with less reliance on black box recommendations. We call the process Cervical Cancer Prevention and Control Costing, or C4P. We'll describe this in more detail, but for now, this graphic will help us to think of C4P as a process that guides a country's key stakeholders through a detailed analysis, development, and formal agreement on a costed plan for scaling up cervical cancer elimination programs, and to think of the C4P tool as underpinning the process. It's an Excel workbook that facilitates recording, documenting, and presenting the results of that process. Since 2012, C4P has been applied in low and middle income countries in Africa, Asia, and the Pacific Islands. Over the past decade, we've received a great deal of feedback from users about the C4P planning process and the tool itself. Among the positive comments that we've heard about the process and the tool have been, this gives us a common language and a focus point for building real plans. The discussions left us stronger and more committed to working together. It gave us what we need to move forward and seek financing. And we've also received other feedback. Comments we received included, there's too much data to collect, or the invasive cancer treatment part is too hard to cost, and needs to be simpler and more user-friendly. In 2021, Unitate and Expertise France engaged Levin & Morgan to update the C4P as part of their Success project. Success stands for Scaling Up Cervical Cancer Elimination Through Secondary Prevention Strategy, and as the name implies, Success is focused on secondary prevention, particularly screening and treatment of precancerous lesions. Success has been field testing HPV DNA screening and thermal ablation in typical clinic setting. Their work includes demonstrating the affordability, accessibility, and appropriateness of these new technologies. They've also been assisting countries to consider possible avenues and approaches to obtaining sustainable financing. They are committed to helping the governments develop transition plans for integrating these new technologies into their routine healthcare system. Success C4P is a fundamental component part of this larger project. The objective of Success C4P is to help countries produce a costed plan for use in policy decision-making, advocacy, and fundraising. I said I'd provide more detail about the Success C4P process. The process consists of 3 steps. First, we review data on plan strategies and approaches to scaling up. If there's no written plan, that's okay. We work through that. We also collect data on target population sizes, epidemiology, health system infrastructure, and human resources. And we collect unit prices and costs for the materials, personnel, and equipment that will be needed to scale up. Next, we input all these data and assumptions into an Excel spreadsheet. The spreadsheet is programmed to calculate projected outputs and costs based on the inputs and assumptions. We present the cost analysis to a group of key stakeholders who are the likely implementers, influencers, decision makers, and funders for the proposed activities and investments. We set aside 2 to 3 days in a retreat environment so they can discuss inputs and results in detail among themselves, both formally and informally. Based on their discussions and agreements, we revise and update the cost analysis and present it to them for validation. We then prepare alternative scenarios and calculate the outputs and costs for review and final validation with the stakeholders. This leaves them with a final report, with a presentation package, and documentation. The perspective of the tool is that of a government planning to provide services through its own network of facilities. The tool calculates both financial and economic cost estimates. It includes both recurrent and capital costs. The tool uses bottom-up ingredients-based costing. The costs produced are incremental costs. The Excel tool is left in the hands of a power user in the government who is trained in its use. It's completely unlocked. It contains details of calculations and sources of information, and it can continue to be updated and used by the government and stakeholders for monitoring expenditures versus projected costs and continued planning. The tool includes a one-page summary of projected outputs and costs. We've included HPV DNA as a screening method that can be planned and costed. We've also added thermal ablation as a treatment option for precancerous lesions. This joins the options of cryotherapy and LEAP-LETs. We've built databases into the tool with pre-populated data tables to give users a head start on filling in critical assumptions. We've built in a database of the population of women by age and year from Afghanistan to Zimbabwe. It's from the World Population Prospects database. You can use it to customize your target populations at the click of a mouse. And we have built-in modifiable database of the unit cost of supplies and materials used in success project pilots of cervical cancer screening and precancerous treatment in the 4 countries in which we're working. Right now, there's about 100 pre-filled line items in this database to make our work easier. There are similar databases for personnel, allowances, equipment, and other direct costs. We've also designed the interface of the tool to be interactive. Here you can see the user can change the desired screening coverage each year using a drop-down list, and the tool will instantly report the resulting number of screenings required to reach that goal. We are also investing beyond the tool itself to make the process of planning and costing a scale-up faster, better, and less costly. For example, we've introduced a step in the process where we hire a local consultant to collect the critical data needed to prepare the tool for use, and we're recording online tutorials on how to use the tool. So far, we have about 30 detailed short help videos in production. The Success C4P process and tool are currently undergoing field testing. 4 countries are leading the way: Burkina Faso, Cote d'Ivoire, Guatemala, and the Philippines. We're anticipating the data collection will be in our pilot countries in the second quarter of this year, and we will be preparing draft scenarios by the third quarter. In conclusion, we believe that accelerating cervical cancer elimination is an achievable goal with the right resources and planning tools, and the continuing development of this costing tool for scaling up cervical cancer elimination will contribute to a major step forward in this effort. We gratefully acknowledge the funding support of Expertise France, Unitaid, and World Health Organization. On behalf of my colleagues and me, thank you. We wish you success. I'll now take any questions or comments about our ongoing work, or you can contact me at win@levinmorgan.com. Thank you for your time and attention.